Hi, I am Dr. Rohan Vakta. I am sports orthopedic and arthroscopic surgeon in Ahmedabad, Gujarat. Currently, I am working in Ash Arthroscopic Center and Zydus Hospital as a sports medicine consultant and arthroscopic surgeon. So, in today's video, we are going to discuss about meniscus tear and its surgery. So, there are many types of meniscus tear. In today's video, we are going to discuss about inside out meniscus repair technique. So if we repair the meniscus with the needle coming from outside of the joint into the joint, it is called outside in technique. If we bring needle inside the joint and get it outside for repair, it is called inside out repair. And there is third way of repair is all inside repair. In today's video, we are going to discuss inside out way of meniscus repair. So first we will see on a artificial knee model that how inside out technique of meniscus repair is done. So this is a knee model. So first with the probe we palpate, we do diagnostic arthroscopy, we check both the meniscus. Here the white thing is a joint capsule. With the probe we see the location of the tear. If it is on the posterior horn, we prefer all inside repair. If from the posterior horn to the body of the meniscus, we can do inside out type of meniscus repair. So after identifying the meniscus tear, we should make sure that we go perpendicular to the tear for the inside out repair. So to go perpendicular for the meniscus repair, you can change your portal also. You can shift your portal, bring the cannula to make it perpendicular to the meniscus tear. So for an example, in this video we are repairing at the junction of the posterior horn to the body of the middle meniscus. It is a double lumen cannula, and from the cannula we are passing the Sironix number 30 inside out meniscus repair needle, and it is the meniscus repair needle pusher. And with the needle holder from outside the body, we are pulling both the needles one by one. So as you can see, both the needles are coming from the posteromedial side of the joint, and once all the needles comes out, you can tighten the thread. The thread will sit closely over the tear and will make it reduced against the capsule. Outside the joint, you can do the sliding knot or any other knot, whichever is convenient to you. The knot should tightly sit over the joint capsule so that the meniscus will tightly reduced over the capsule and there is no chances of re-tear in the future. After alternate half hitches, once the knot is completely tight, you can cut it. So this was the one demo of inside out meniscus repair. So there are different zone specific cannulas: straight single lumen cannula, curved, right and left curved, upward and downward cup, meniscus repair zone specific cannula, by using which we can pass 30 fiber wire attached with sharp needle, which can pass easily through these zone specific cannulas, and it can be used for inside out meniscus repair. To freshen the margin of the meniscus tear, this rasp is used. Rasp will remove all the fibrous tissue and will increase the blood supply adjacent to the tear. So now we will see a case where there is a displaced locked middle meniscus bucket handle tear. As you can see, the tear is extending from the posterior horn right up to the body and the anterior horn. So tear is first reduced through the probe. As you can see, it is a meniscocapsular separation. So if we remove this meniscus, there will be total loss of the meniscus and the chances of arthritis will increase. So here the first meniscus is reduced and the location of the tear is identified. Now with the probe, the trajectory for the upcoming inside out meniscus repair is decided. With the rasp, all the fibrous tissue is removed and the blood supply is increased at the meniscocapsular junction. For the posterior horn, we can use all inside type of meniscus repair. For anterior horn, we can do outside in type of meniscus repair. For the middle part, inside out is preferable. With the shaver, you remove all the fibrous tissue, but make sure while using the shaver, the suction is switched off. If suction is on, it can suck normal meniscus tissue also. Now this is a double lumen straight zone specific cannula. As you can see, the needle has come out of the posteromedial side of the skin. Your assistant can one by one bring and pull both the meniscus needle. As it is a 30 fiber wire, you have to make sure that you do not crush the fiber wire with your artery forceps. So one thread is passing through the capsule and another thread is passing through the meniscus. So it is a vertical mattress type of stitch which is used to reduce the meniscus. So one by one in the different zones, using the different trajectories, you can pass different categories of tear like vertical mattress, horizontal mattress. After passing all the stitches, you check the reducibility of the meniscus and the stability. Sometimes there is eversion of the meniscus because of so many stitches on the upper surface, so you can pass on the under surface also to make it stable. After different stitches are passed and meniscus is well reduced, outside the body you can see all the threads coming out of the skin through the meniscus. You can put a single incision and retrieve all the threads through that incision, and one by one in the pair of the threads you take sliding knot. This knot should tightly sit over the joint capsule and it will reduce the meniscus. So do proper dissection, go right up to the capsule, retrieve all the stitches and take sliding knots one by one. So it will reduce your meniscus. So that is the use of the meniscus repair inside out needles. There are different other ways of repair also. So but inside out is quite versatile. It can be used for large tear also, and it is quite economical also. Thank you.